All right, let's talk about something really serious. One of the biggest threats out there for young dogs, canine parvovirus.
You're looking at this adorable puppy, right? Well, one of the biggest dangers it faces is a virus that can live in your own backyard for over a year. It's tough, it's resilient, and it's scary common. But don't worry, knowledge is your best weapon here. And that's what this explainer is all about, giving you the essential info you absolutely need to keep your pup safe. So here's how we're going to tackle this. We'll start with what parvo even is. Then we'll get into that scary puppy danger zone, how to prevent it, what symptoms to look for, treatment and survival rates, and finally, how to disinfect everything. It's basically your battle plan. All right, first up, what is parvovirus? So what exactly is this villain we're dealing with? And let me tell you, this is way more than just a simple tummy bug. It's like a highly evolved survival machine. So, the official name is Canine Parvovirus, or CPV2, and it attacks the fastest-growing cells in a dog's body. Think of the gut and the immune system. But here's the really important part. It's what's called a non-enveloped virus. Now, what does that mean? Well, a lot of viruses have this soft, fatty outer layer that's pretty easy to break down with soap and stuff. Parvo? Nope. It has this super tough protein shell, almost like armor, which makes it incredibly hard to kill. And that's what makes it so dangerous.
And how does it spread? Oh man, just about every way imaginable. It's not just dog to dog. It's in contaminated poop, the soil, the grass. It can be on bowls, leashes, anything. It can even hitch your ride on your shoes or your clothes, and you can bring it right into your home without even knowing. It's just everywhere.
Okay, so you're probably wondering, can I get it? And the answer, thankfully, is no. Humans get their own version of parvovirus, B19, but you can't get the dog version. But, and this is a really, really big but, you can be a taxi service for the virus. You won't get sick, but you can carry it on your hands or your shoes from one place to another, and that's how you can accidentally infect the dog.
Okay, that brings us to the puppy danger zone. Why are puppies so incredibly vulnerable to this? Well, it all comes down to this really tricky, really dangerous gap in their immune system's development. As the AVMA points out, it's all about timing. See, when puppies are born, they get a fantastic starter pack of immunity from their mom's milk. It's a great head start, but the problem is, it doesn't last.
And that fading protection creates this incredibly dangerous gap. We call it the window of susceptibility. Honestly, if you're a new puppy owner, this is probably the single most important thing you need to understand.
So here's how it works. First, the puppy gets those antibodies from mom's milk. It's like a temporary shield. But over a few weeks, that shield starts to wear down. And here's the really tricky part. You reach a point where the shield is too weak to protect the puppy from the actual virus. But it's still strong enough to block a vaccine from working. It literally cancels the vaccine out. That gap, that's the danger zone. And that is exactly why a full series of puppy shots isn't just a suggestion. It's absolutely critical.
So, how do we protect them? This is where your best defense comes in. Vaccination and hygiene. It's a 1-2 punch.
First, the vaccination schedule. This isn't random. The reason for all those boosters at 6 to 8 weeks, 10 to 12 weeks, and 14-16 weeks is to try and land a working vaccine the moment that mom's protection wears off. We're trying to close that window of susceptibility. And that last shot, the one at or after 16 weeks, that's the big one. That's the one that really slams the door shut on that danger zone.
But vaccines aren't instant. While that immunity is building up, you gotta be smart about hygiene. Seriously, you have to treat the world like a potential minefield until your vet says you're fully protected. That means no dog parks, no pet shops where lots of dogs have been, and for goodness sakes, never let your puppy near another dog's poop. Always pick up.
Okay, but what happens if the worst happens? What if, despite everything, a puppy gets sick? Now we're in a race against the clock. Recognizing the symptoms and acting fast is everything.
And the signs come on fast and they hit hard. We're talking lethargy. Your playful puppy just doesn't want to move. They lose their appetite. They might have a fever. And then comes the really awful stuff, vomiting, and severe, often bloody diarrhea that has a very distinct and terrible smell. If you see these signs, especially in a puppy, you don't wait. You go to the vet immediately.
Yeah, this quote says it all. Most deaths happen within 48 to 72 hours. That's 2 to 3 days. This is absolutely not a wait-and-see situation. The clock is ticking from the very first symptom.
And that takes us to treatment and survival. Let's be really clear here. The difference between going to a vet and trying to manage this at home is quite literally life and death.
Just look at these numbers. If a puppy with parvo goes untreated, the mortality rate is over 90%. It's just devastating. The virus is too aggressive for their little bodies to fight off alone.
But with aggressive vet care, the survival rate flips to around 90%. I mean, look at that. It's an absolutely incredible turnaround. And it just proves why getting to the vet right away is so critical.
So how does treatment work? Well, there's no cure for parvo. There's no magic bullet that kills the virus. The entire treatment is what we call supportive care. We're basically propping the dog's body up. We give them IV fluids to fight dehydration. We control the vomiting and diarrhea. And we use antibiotics to prevent other infections from taking hold. We're basically just keeping them in the fight long enough for their own immune system to build an army and win the war.
Okay, last section, the disinfection protocol. So, whether your dog is recovered or you've just been somewhere you think might have been contaminated, you have to break the chain of infection. You've got to kill this virus in your environment.
And remember what I said about that tough outer shell? Well, it means most of your regular cleaners won't work. Alcohol-based stuff? Useless. Quat-based cleaners? Nope. You need the big guns. Bleach is the gold standard here. It's cheap and it works. There are a few other specific chemicals that work too, but for home use, bleach is your best bet.
And how you do it matters just as much as what you use. You can't just spray bleach on a mess. It won't work. Step 1, you have to clean first. Get rid of all the poop, vomit, whatever, with soap and water. The disinfectant can't penetrate organic gunk. Then you apply your bleach solution. A 1:30 mix with water is good. And here's the most important part. You have to let it stay wet for at least 10 minutes. No wiping it off right away. That contact time is what actually kills the virus. Then you can rinse and dry.
So you can see how parvovirus is really a community problem. Vaccinating your dog, being careful where you take them, and cleaning up properly, it isn't just about protecting your dog. It's about protecting every puppy in your neighborhood, at the park, everywhere. It's about being a responsible dog owner. So it leaves us with this question. How will you help protect the dogs in your community?